Hello again. Talking about today at the Ask Dr. Pane segment, somebody was asking about CO2 laser to the face. And they're going to be getting some eyelid procedures. And the question is, can they just do CO2 laser to the face instead of one of these other procedures? It's a pretty good question. The reality is the surgical procedures, and in this case, we were talking about upper and lower eyelids and a little bit of and removal of some of the excess fat from the lower lids. Uh, that is addressed surgically, and the CO2 laser will not address those same issues. You don't want to be lasering eyelids with CO2 laser. That is not a good idea. Keep in mind that the CO2 laser, the benefits of it are overall skin rejuvenation, and it reduces the sunspot, sun damage type skin and fine lines, and there's a little bit of a tightening effect of the skin, but it's not a replacement for a facelift or some other type of surgery. So if that's being considered, you don't want to say we would just do a CO2 laser instead. It doesn't work that way. CO2 laser, again, when we talk about the ablative CO2 laser, that's a one treatment, a little bit longer recovery because there's some scabbing and so forth and wound care that has to be done to get the skin healed. Or you talk about the Fraxel, which is CO2 laser that's a little less intense. And in that case, it's about one treatment a month, continued usually for about 5 or 6 months. So it's a question of, do you want to have all your recovery time up front, or do you want to stretch it out over a longer period of time? That's the basics of CO2 versus Fraxel, which is another question for a different time. But the surgical care here, the eyelid surgery, is not going to be something that you could substitute out for the laser. What I would say here is, if the eyelids are the problem, take care of that. You get good results in most cases with experienced surgeons, and then see how your face is looking. And if you have the fine lines and the sunspots and the other issues, then you come back and do the CO2 laser. Not on the eyelids itself, because that skin is too thin for that, but it can also help you get the full effect. You may find that if the main problem is the eyelid conditions, either the bags or the sagging skin, you may be happy enough with your appearance. You may end up not doing the laser at all, and then it saves the situation. But if your concern was the eyelid, lower lid bags, or sagging skin of the upper lids, the laser is not really going to address those. So if that was your main concern, it's not going to be addressed by having the CO2 laser. So that's why I would tell it to you in the other way, so that it saves you from having to get a second procedure that you may or may not want. But if you did it the other way around, you're likely going to be getting that second procedure to do the eyelids, because the laser won't address those. So a little bit involved answer, but hope that covers it for you, and best of luck to you.